Hello everyone. Today I will talk about searching tips for the treatment modality. Sometimes we do not know what to do with certain problems. Sometimes we seek better possible treatment procedures. Sometimes we are just curious about other treatment modalities performed by other acupuncturists like in Korea or Japan or China. You can find the treatment modalities with this method I'm introducing now. These modalities can be both very widely used standard procedure or very specific methods which have been transmitted secretly from family to family. With RCTs, randomized controlled trials, you can find more general modalities, and with case reports, you can find more specific ones. We usually use Pubmed for searching medical journals. Pubmed is a very good service, and I think it is mostly more than enough for regular purposes like finding the most updated RCTs or systematic review. Pubmed comprises more than 30 million citations for biomedical literatures. This is important. This is a citation service. This is the problem. With this regular PubMed search, you cannot find these detailed treatment procedures because they do not supply full text, but only citations. So this is the relation between PubMed and Medline and Pubmed Central. PubMed is citation service, so they only supply abstract and other citation information. But this is the largest database, and it includes Medline and Pubmed Central. But this Medline supply full text service, but it is paid service. The point is the PMC service is a free service applying full text. You may use Medline or Ovid if you are contracted personally or in school. If you cannot access those paid providers, Google PDF search or ResearchGate can be a good alternative sources, but today I will show you searching tips with PMC. This is PMC. Pubmed Central, this is the first page of PMC search. If you see this address bar here, nih.gov/PMC. Only difference with PubMed is this section, PubMed and PMC. As you see here, PMC, it is called Pubmed Central, is a free full-text archive of biomedical and life science journal literature at the U.S. National Institute of Health National Library of Medicine. It can be a good source of information for regular acupuncturists. So it is free and apply full text. So it is good to use for finding modality. Now let's try to find the treatment modalities for carpal tunnel syndrome. Just for example, I will just type all the keywords sequentially like this: acupuncture, carpal tunnel syndrome. So if you see here, I found 500 articles. This is not very specific way of searching. I cannot browse all these 500 articles. So let's try different strategy. I will add mesh in a bracket and quotation mark here and TI. Let's hit the button. Mesh is a hierarchical vocabulary that is used for indexing articles in PubMed with more specific terms organized underneath more general terms. So if you are looking for some treatment modalities, you'd better use mesh with bracket behind that term. And I attach it TI, that means title, in a bracket. So because they find articles which contains carpal tunnel syndrome in the title. This mesh and PI is a search tag you can use in both PubMed and PMC, Pubmed Central. They follow same rules, but Ovid and EMBase has different rules. So I hit the button here, we got 8 results. Only 8 results. I think 8 is enough. What actually we need to focus on is not the numbers, but their methods. Let's start with this first article, hypothalamus and amygdala response to acupuncture stimuli in carpal tunnel syndrome. Let's see. And let's jump into a method section we are caring about. If you read here, you can find that here, acupuncture treatment. They treated patient for 10 minutes with 2 Hz electroacupuncture, and you can see the point selections like this. So they provide general information, but I'm not seeing the actual size of needles or depth of the needles, so I don't think it is a very good presentation of acupuncture treatment. And they clearly says that there was a dirty response. That is something you need to do to reproduce the result. Let's try another article's case report. This is interesting. With the case report, you can find more specific, interesting, inspiring treatment. Let's see. Let's click this. They supply PDF. Wow, surprisingly, they did not mention any method they used. Just for example, this is my case report regarding my unique treatment modality for acute back pain. This method is only well known to Korean acupuncturists. In this article, you can see the procedure in detail, point selections and needle size, depth. So practically you can try this method in your practice. This is the good way of presentation for case studies, but many case studies sometimes they miss this procedure part. So let's try other articles. This one looks very interesting. It's about acutomy, but this is the systematic review. Usually systematic review does not apply detailed treatment procedures, so let's just skip this. This one looks nice, acupuncture and related intervention for treatment of symptoms associated with carpal tunnel syndrome. Let's see, but this is the Cochrane database. So it looks like a systematic review, another systematic review, so we don't have to look this, but later I will read this, and this one looks very interesting. And this one, rewiring the primary somatosensory cortex in carpal tunnel syndrome with acupuncture. Actually, this is a very famous article. If you read this method section, all the information that you need to produce the result in detail. So let's see acupuncture treatment. They treated the patient 8 weeks. So in 8 weeks, you can see the result. And using tapering schedule, and this is a very common way of treating carpal tunnel syndrome. And this is how they taper down the treatment schedule. Let's see, and they use this point, and they use 2 Hz, same frequency as the later article, 20 minutes, retaining time, and point selections, the needle size and needle depth. Actually, if you see this picture here, you can see where they put the needles and how they connect the ear-stem. So this is a very good presentation of the acupuncture method. And I'm curious how the result went, and you can see the results section. I will jump into the graph here. So this is the verum, the real needle. This is the sham. This is sham. At first, the symptom is improved, but with sham needle, patient to control group, their pain is regained, rebounded. But with the verum acupuncture, it lasted around 3 months. And let's see another table here. This is about nerve conduction, latency, and this is the verum group. So this is actual experimental group, and this is local, distal. Regardless where the acupuncture was done, with the actual needle, the nerve conduction latency is improved, while the sham needle group, control group, didn't show any improvement in nerve conduction latency. So this is very interesting. You can read whole article carefully. Actually, this article is worth to spend some time. Besides that, what really I want to tell you is the fact that with this detailed method here, you can reproduce the same result. And let's try another article here. This is a randomized control trial. Let's jump into method here. They didn't clearly presented what kind of method they used. So with this one, you cannot find any interesting treatment modalities. So let's try other one. This is about laser acupuncture, but this is study protocol. This is the study protocol. But also they can give you good insight regarding treatment modality. Let's see. The design, they follow the consort guideline. That is a very good guideline, and you can see the point selections here. This is a very good presentation on this point, and how they treated the frequency. This is very useful information when you actually see the patient in your practice. And if you are thinking about applying laser acupuncture, they clearly show you what kind of wavelength they use, and output, and the power densities. So you can use this method, and you can reproduce the same result with these detailed procedures. So I think this is very interesting. And let's see more articles. This is the last article. Let's see, local effect of acupuncture. Let's jump into method here. So you cannot see any detailed method here. So we quickly browsed all these 8 articles. Some articles clearly shows in detailed procedure, and some articles didn't clearly presented what they did in their studies. And there is a guideline called Stricta, which helped the people produce better clinical studies with acupuncture. Here you go. Details of needling. This is the list of Stricta guideline checklist. So if you see here, number of needles and brand names, depth of insertion, response sought. So in detail, we need to clarify what kind of method we used. Good acupuncture clinical studies following Stricta guideline well can give us good guidance for treatment procedures, which can reproduce same result in the studies. We just learned searching tips for treatment modalities through the Pubmed Central. I hope this clip can give you good inspiration for searching for better treatment options.